Welcome to our training session on basic nutrition. The role of nutrition. According to WHO, nutrition is a critical part of health and development. Better nutrition is related to improved infant, child, and maternal health, stronger immune systems, safer pregnancy and childbirth, lower risk of non-communicable diseases, such as diabetes and cardiovascular disease, and longevity. Nutrition refers to the intake of food to meet the body's needs. Nutrients are substances found in food that are essential for survival. Nutritional components that are primarily separated into two categories. Macronutrients are the compounds that humans consume in largest quantities, mainly classified in carbohydrates, proteins, and fats. Micronutrients are instead introduced in small quantities, but they are required for an adequate growth in the pediatric age, especially zinc, iron, vitamin D, and folic acid. Types of carbs. Simple, found in fruit juice, syrup, honey, and refined sugar. Refined, processed carbs with reduced fiber. Examples: white bread, white rice, white pasta, cereals, pastries, desserts. Complex, rich in fiber. Slower digestion. Examples: starchy vegetables, white and sweet potatoes, peas, corn, legumes, beans, lentils, whole grains. Proteins. Proteins are large molecules made of amino acids. Proteins are found in animal and plant foods. Proteins are the main structural constituents of the cells and tissues of the body. They are essential for growth, maintenance, tissue repair, enzyme production, and hormone function. Examples of proteins: chicken, turkey, salmon, tuna, milk, yogurt, tofu, chickpeas, lentils. Fats in nutrition. Fats in nutrition. Fat is a vital part of a balanced diet, helping absorb fat-soluble vitamins A, D, E. Excess fat is stored as body fat, like in used carbs and proteins. Fat is crucial for children's growth and brain development. Instead of cutting fat from their diet, replace unhealthy fats with healthy ones. Examples: saturated fat in whole milk, coconut oil, salmon versus unhealthy fats in pizza, fries, and processed meats. 6 essential nutrition. Micronutrients, often referred to as vitamins and minerals, are vital to healthy development, disease prevention, and well-being. Iron. Iron develops the brain of a fetus and child. A deficiency in iron leads to anemia. Folate. Folate helps prevent serious birth defects of the brain, spinal cord, and skull. A deficiency in folate can lead to birth defects, megaloblastic anemia, and depression. Vitamin A. Vitamin A supports healthy eyesight and immune system functions. A deficiency in vitamin A increases the risk of blindness and death from infections such as measles and diarrhea. Iodine. Iodine is essential for babies and children to form thyroid hormones, which are important for healthy growth and cognitive development. A deficiency in iodine can lead to developmental delays and is the most common cause of preventable intellectual disability. Zinc. Zinc is important for immune function, wound healing, and the senses of smell and taste. A deficiency in zinc restricts childhood growth and decreases resistance to infections. Vitamin D. Vitamin D is required for muscle and nerve functions and helps the immune system fight off bacteria and viruses. A deficiency in vitamin D can lead to bone diseases, rickets, and osteomalacia. The importance of breastfeeding. The U.S. Dietary Guidelines for Americans recommend that infants be exclusively breastfed for about the first 6 months, and then continuing breastfeeding while introducing appropriate complementary foods until your child is 12 months old or older. The American Academy of Pediatrics and the World Health Organization also recommend exclusive breastfeeding for about the first 6 months, with continued breastfeeding along with introducing appropriate complementary foods for up to 2 years of age or longer. Babies who are breastfed have a lower risk of asthma, obesity, type 1 diabetes, severe lower respiratory disease, acute otitis media, ear infections, sudden infant death syndrome, SIDS, gastrointestinal infections, diarrhea/vomiting. Mothers who breastfeed their babies have a lower risk of breast cancer, ovarian cancer, type 2 diabetes, high blood pressure. Key recommendations for infants and toddlers. According to U.S. Department of Agriculture and U.S. Department of Health and Human Services dietary guidelines for Americans, at 6 months, introduce nutrient-dense complementary foods. Water is usually unnecessary in the first 6 months for healthy infants with adequate human milk or formula intake. Offer a variety of foods, especially iron and zinc-rich foods for breastfed infants. Avoid added sugars and limit high-sodium foods and drinks. From 6 to 23 months, provide vegetables and fruits rich in potassium. Vitamin A and vitamin C introduce complementary foods at 6 months, avoid before 4 months. Cow's milk as a beverage should be introduced at 12 months or later. Complementary foods should be nutrient-dense without added sugars or sweeteners. No honey, raw or cooked, for infants due to botulism risk. Avoid unpasteurized foods, juices, milk, yogurt, cheese, to prevent harmful bacteria. No caffeine for children under 2, high choking risk foods, for children under 4. Popcorn, whole kernel corn, nuts, seeds, large chunks of meat, poultry, cheese, hard, raw fruits/vegetables, apples, celery, carrots, whole grapes, cherry tomatoes, unless quartered, hot dogs, unless cut into strips. Sticky foods, e.g., thick peanut butter, fish and meat bones. Food allergy. A food allergy is a potentially serious response to consuming certain foods or food additives. For those who are sensitive, a reaction can occur within minutes or hours, and symptoms can range from mild to life-threatening. The 9 leading causes of food allergies identified in the U.S. are milk, eggs, fish, shellfish, tree nuts, peanuts, wheat, soybeans, and sesame. The symptoms of food allergy in a child. Allergic symptoms may start within a few minutes to an hour after eating the food. Each child may have different symptoms. These can include severe nausea or vomiting, diarrhea, stomach cramps or stomach pain, red, itchy rash, hives, face swelling, eczema, itching or swelling of the lips, tongue or mouth, throat itching or tightness, dizziness, with lowered blood pressure, asthma symptoms, such as coughing, runny or stuffy nose, wheezing, or trouble breathing, a feeling of impending doom. Key recommendations for children. Parents and caregivers play a key role in promoting healthy eating by controlling the foods children consume. Introducing a variety of nutrient-rich foods helps establish healthy eating habits early on. Daily fruits and vegetables are essential for growth and brain development. Early food experiences shape future eating habits. Each child is unique in terms of age, physical, and cognitive development, and their nutrition should be tailored accordingly. Involve children in meal planning and shopping and encourage healthy choices. Avoid sugary drinks and offer 100% fruit juice instead. Children will need extra water when they are exercising or in hot climates. Remember that children need to drink regardless of the weather, even in the winter. Even if they aren't thirsty, encourage children to drink before, during, and after physical activity. This can help prevent dehydration. Ensure kids get enough calcium and vitamin D for strong bones. Encourage children to eat balanced portions from each group of food: fruits, vegetables, grains, protein, and dairy. Children should never be given vitamin or mineral supplements indiscriminately without a doctor's supervision. Parents and caregivers should be aware of common eating-related issues that arise at different ages and take responsibility for their early diagnosis. Parents and caregivers should never apply unverified information about nutrition. Instead, we must research from reliable sources and keep ourselves updated. Key recommendations for adolescents. A surge in appetite around the age of 10 in girls and 12 in boys foreshadows the growth spurt of puberty. Protein. Proteins function as building blocks for bones, muscles, cartilage, skin, and blood. They are also building blocks for enzymes, hormones, and vitamins. Adolescents should consume the right amount of protein appropriate for their age and gender. Carbohydrates. Simple carbs should be minimized in the diet. Dietary fat. Fat supplies energy and assists the body in absorbing the fat-soluble vitamins A, D, E, and K, but these benefits must be considered next to its many adverse effects on health. A teenager who indulges in a fat-heavy diet is going to put on weight, even if she's active. Vitamins and minerals. Unless blood tests and a pediatrician's evaluation reveal a specific deficiency, it's preferable to obtain nutrients from food instead of from dietary supplements. Adolescents should be closely monitored for eating disorders, including anorexia nervosa, bulimia nervosa, binge eating disorder, BED, and avoidant restrictive food intake disorder, ARFID. If there are any suspicions, medical support should be sought as quickly as possible. Thank you for watching the Basic Nutrition module. Please answer the questions for this training before moving on to the next training module.